All right, so today we'll be measuring the patient's blood glucose. Before we can give them insulin, we have to make sure that it is, too high or too low. We want to check for those signs and symptoms of hyper or hypoglycemia. The normal is about 70 to 100. And then depending on the physician's order, we will give the medication or the insulin however many units compared to what the physician has ordered. So I've got all my supplies, so go ahead and go into the patient's room. Hello, my name is Catherine. I'll be your nurse today. We're going to check your glucose. That way we can give you the correct medication, the correct insulin dose. So if you will verify your name and date of birth for me. Alright, Theodore Bear, date of birth 5/5/1995, so that is correct. Alrighty, so I'll let you go ahead and wash your hands, make sure they're dried. Alright, so we'll do hand hygiene. Alright, so I checked with patient, it is the correct order. We are to draw the patient's glucose. Go ahead and get everything ready. Test review. Alrighty, so we'll go ahead and we'll get your finger, and I'm gonna do it on the lateral part of it, the side of it, so that way it's not hitting those like the pads of your fingers where it's more sensitive. So we'll do the side. Go ahead and that side. Alright, let it dry off. Alright, so I've got the machine ready. Alright, so we'll do the side of the finger. Right, big stick. Alrighty. Go ahead and take the blood out. Go ahead and wipe off that first drop. Go ahead and squeeze enough blood. Go ahead and put that blood on here. Alright, I'll give you this little cotton ball, that way you can stop it from bleeding, clean off the site. Alrighty. Wait for it to result. Alrighty. Alright, so it has resulted. I'll go ahead and put this test strip in the sharps container. Cotton ball in the sharps container. Go ahead and put everything up. Go ahead and clean my machine. Alrighty, so with the results, it looks like your glucose is a little elevated. So I'm gonna go check and see what the doctor has ordered, what insulin we're going to give you, and I will be back with your insulin, okay? Alrighty, I'll be back. Alright, so I would go on my MAR, document that I performed the glucose check on the patient, where it was given, or where the injection was. The injection was where I put the lancet, and the patient did tolerate well. and I'll go ahead and document what the glucose was. It was elevated, and I will give the amount of insulin in units depending on what the doctor has ordered.